In today's lecture, we're going to focus on the heart, and there's three main learning outcomes associated with this lecture. Remember, before you proceed to the next lecture, you want to make sure that you can execute these learning outcomes, that you can do them, you can describe them, you can explain them. So let's go ahead and get started here. And the first thing we're going to talk about is the location, the surface anatomy of the heart. Okay, so what is the location and what is the surface anatomy? Well, the heart is described as a double pump, and there's two main functions to it, or two main parts that we think of. The first one is something called a pulmonary circuit, and the responsibility of the pulmonary circuit, which is the right side of the heart, is to get oxygen from the lungs. The second function is the systemic circuit, and this is the left side of the heart, and the function of the systemic circuit is to pump or push blood throughout the body. So if we want to visualize it, we can have a diagram like this. Whenever you're looking at diagrams like this, and you'll see a lot of them throughout this lecture and the next lecture, blue always means the blood does not have oxygen, or it's deoxygenated. Red means that the blood does have oxygen, or it's oxygenated. Okay, we also want to note the heart has four different rooms, or four different chambers. Two of the chambers are called atria. Those are the ones that receive blood. And then we have two chambers that are called the ventricles, and those are the ones that push blood out of the heart. Okay, let's continue this discussion about the surface anatomy and the location of the heart. Well, a typical healthy human heart weighs a little less than a pound, about 250 grams, and it's the largest organ of a structure called the mediastinum. And the mediastinum, if you look at it down below, is a structure that encloses basically a bunch of organs and structures that are between the lungs. So to give you an idea, within the mediastinum we have the heart, the esophagus, the trachea, we have the thymus, we have some lymph nodes, and then many, many other structures as well. The reason we note this mediastinum is that you'll see it whenever you do a dissection. But we also note it because if there's ever inflammation of the mediastinum, and it's called mediastinitis, you can actually have a lot of problems because you'll get fluid buildup in and around the heart, and there's nowhere that this fluid can go because it's enclosed in this structure called the mediastinum. And what happens is the heart itself has trouble pumping. So it's very important that you don't have any type of infection of the mediastinum. Okay. Let's look a little bit further here. And so we could see that we have the apex of the heart. You could see that on the bottom right picture. And you could see that we have something called the base of the heart. And so this is the orientation of the heart in the body. Let me go ahead and get my pointer here just to show you this. We have the apex of the heart right here, and then the base is sort of right down here. So the heart is sort of, not really symmetrical in the body, but it's sort of oriented in an oblique manner, we call it. Okay, let's look a little further here. So if we want to say exactly where is the heart in your chest, if we were to look at the surface of someone's body, physicians often use something that's a good clinical application. They use something called the four corners of the heart. And so what they're saying is that if we want to say where is the superior portion of the heart, or the part that's towards the head, or the inferior portion that's towards the feet, they use these four corners to denote exactly where the heart would be in someone's body. Okay, and so I'm going to let you read through them on your own here, but we have the superior right, the inferior right, the superior left, the inferior left. And really what they use is they use the ribs and the costal cartilage that connects the ribs to the sternum to denote where the heart would be in someone's body. And you might say, okay, well, who cares? Why would we do this? Well, if you're going to a physician and you're getting an x-ray, they can actually use these, quote, four corners, right, to describe and to tell if someone has an enlarged heart, for example. So it's a really nice marker that has a lot of clinical significance to it. Okay, so that's the location and the surface anatomy of the heart. Let's go a little bit further now and talk about the structure and the pumping of the heart. Okay, so when we look at the structure of the heart, it's really a matter of all these different coverings, and there's a lot of coverings. So the first one is something called the pericardium, and the pericardium is composed of different layers to it. And I know on this slide I have two primary layers, but really when I think of the pericardium, I think of it as a triple layered sac. So this two right here depends who you talk to. So I left two because that's how it's officially described, but really I think of it as three. You might say, well, what are these three? Well, the first part of the pericardium, and remember, peri means around, cardium comes from the Greek word kardia, so it means around the heart, right? Coverings around the heart. Okay, the first layer is something called the fibrous pericardium. So I'll put a little number 1 there, right? And this is a strong layer of dense connective tissue that surrounds the heart. It's very important. It's very strong, very dense, and it's not easy to puncture it. Now, here's the thing that you want to think of. What it does, what is the point? Well, it holds the heart in place in the body, so the heart isn't like floating around your chest cavity, right? So it holds it in place. And the second thing is that it's so strong it helps prevent the heart from overfilling with blood. Okay, let's look at the next two layers here. So the next two layers are found within something called the serous pericardium. Whenever we talk about serous, meaning a cavity between two membranes. We've talked about this before in the course. So serous, again, means cavity between two membranes. So let's take a look at this here. So the next two layers are here, and this is why I think of three. So the second layer is something called the parietal layer, right? The outside layer of the pericardium. And then the next one is the visceral, which always means inside. So although we describe the pericardium officially as two layers, as you see up here at the top, really I like to think of it as a triple layered sac. And these are the three layers that I would describe here. Between the parietal and the visceral layer, you have this cavity here. So right in the middle, right here, right? Now this isn't a picture, but in the text, we have a little cavity here, right? So here's our cavity. And really what this is filled with fluid that helps reduce friction. So when the heart's pumping, that fluid that's inside that cavity, inside that serous cavity, prevents the heart from sort of abrading or being abrasive against the external wall of the thoracic cavity. So it helps, reduce friction. So if we look at it, you can see a nice little diagram here. Again, we have the pericardium. We have it broken down into different sublayers. If we pull this up here, and I apologize, my word cavity is a little over the text there, but I think you can see it still. One thing I want to note is this. When we talk about the 1, 2, 3 layers of the pericardium, that last layer, that visceral layer, really is the exact same thing, and I'm going to draw over my text here. It's the exact same thing as the epicardium. So that visceral layer right here, I want you to consider that is the same thing as the epicardium. All right, so a little overlap there. Okay, if we go ahead and keep going further here, we have something called the myocardium. Remember, whenever we have myo, we're talking about muscle. And this is basically the cardiac muscle itself, and it's arranged in a circular pattern, and this is what helps the heart pump. Below that, so deep to the myocardium, we have the endocardium. And this is a layer of connective tissue. It lines the inside of the heart, inside of the chambers, as well as the valves of the heart, which we'll talk about in a second. And really when we're talking about this, we want to note a few different things here. So whenever we talk about the pericardium in general, there is something called pericarditis. And it's really a very important thing that could happen. That could be an abnormality where it's caused by an infection or an inflammation. And what happens is, again, this internal membrane starts filling with fluid and the heart has trouble pumping. So it's a real clinical application. And it can be caused by an infection. It can actually be caused by a stab wound. If you think of that, if the knife is able to penetrate this layer a little bit and you start bleeding, right? The rate at which the blood accumulates is too fast for it to drain through that little tiny hole that was made by the knife. And so again, you get this sac filling with fluid and the heart cannot pump properly. So there's a lot of clinical applications here. Okay, if we look a bit further here on this myocardium right here, we have something called the cardiac skeleton that results or sort of, encompasses that myocardium, that muscle. So let's look at that a bit further on the next slide here. Okay, so here's the cardiac skeleton. And so what it does is it surrounds all 4 valves, right? It's composed of dense connective tissue. If we look at it, it looks something like this. So here are 4 valves of our heart. Just want to point them out here. We have something called the mitral valve. We have something called the tricuspid valve. Together, we refer to them as the atrioventricular valves, right? Because they separate the atria from the ventricles. Then we have 2 other valves here. We have something called the aortic valve and something called the pulmonary valve. And each of those individually, we also refer to those as the semilunar valves because they look like sort of little moons, right? If you look at the little sections here in each of them. So whenever we say aortic and pulmonary, I'm always going to say aortic semilunar valve, pulmonary semilunar valve. So I would add that into your notes right now, that word semilunar. If we look at the mitral valve, it's also called the bicuspid valve because there's 2 parts to it, or 2 cusps. You can see them there. And the tricuspid valve, well, you can tell, tri is 3. We have 3 parts to it right there, 3 cusps. What are the functions of this cardiac skeleton in general? Well, they anchor the valves. They prevent overdilation of the valves. They don't open too much, right? They're the points where you have a connection with the cardiac muscle. And then finally, they block direct spread of electrical impulses. So the heart is firing at a proper rate. Whenever you have a heart contraction, it is induced or it is caused by an electrical impulse. And we're going to talk about that in the next lecture. We're going to save that for them because there's actually quite a bit to it. But I just want you to realize that at this stage that the cardiac skeleton does prevent the spread of electrical impulses. In other words, not going all over the place, but they're only going where they should to help the heart pump in a proper manner. Okay, so that's a little bit about the structure and the pumping of the heart. Now I want to go through and talk about the flow of blood through the heart. We're going to look at that. So we're going to follow it through. Okay, so what are the heart sounds that we have? And this has to do with the flow of blood, so we'll talk about this a little bit more now. Well, again, we have our 4 valves here, right? And whenever you hear the lub of the lub-dub sound, so we always, describe the heart as like, sort of like that, right? So lub-dub, lub-dub, lub-dub. The lub is the closing of the atrioventricular valves, right? So the mitral valve or the bicuspid valve and then the tricuspid valve. The second sound, or the dub, is the closing of those semilunar valves that I mentioned. So that's sort of how you get that, that sound. Also, we have a heartbeat, right? And a normal heartbeat at rest is about 70 to 80 beats per minute, right? And we also have something called the blood pressure. And really, this is, the force that the blood is applying to the walls of your vessels. So it's a very important thing to think of. If you don't have enough force, blood's not going to move fast enough. That's usually not a problem, right? But, could be. If you have too much force, really the blood is pushing so hard against the vessels that, in theory, you could have a vessel rupture, or at a minimum, you could be at risk for heart disease or even things like a stroke. So I'll talk about these terms a little bit more. So systole and diastole, or we often say systolic pressure and then diastolic pressure. So what do these mean when you have someone's blood pressure? Okay, so the systolic pressure or the systole pressure is usually about 120, right? That's the pressure that we use. And really that's the pressure when the heart itself is contracting. So that's what that picture is trying to show you. You have a heart flexing there, right? So it's contracting. So it's the force, every time the heart contracts, the force of the blood as it's being pushed through the vessels against the vessel wall. We always had that being the top number in our fraction here. The bottom number is something called the diastolic pressure. And what this is, again, it's still the force of the blood against the vessel walls, but it's that force when the heart is relaxing, right? When the heart is at rest. And so a healthy blood pressure is 120 over 80. Really that top number, if you get between 120 and 140, it's sort of pre-hypertension. Once you get above 140, we get concerned about someone that their pressure is too high. The diastolic pressure, since it's at rest, there's a little less variation there. So between 80 and 90, it's sort of a warning zone, right? Again, pre-hypertension. If that bottom number is over 90, then we say someone has hypertension again, and we're worried that there's too much force needed to get that blood throughout the body. This can be caused by obstructions in the vessels or many, many other factors. So it's a simple measurement that we use, right? But it has such power to it, and there's so much information we can gain from it. So really, it's a warning sign of many, many things that someone can investigate further. So again, 120 over 80 is sort of what you shoot for, and if those numbers can be lower than that, it's always better. If you look at an Olympic sprinter or a swimmer, usually the numbers are much lower. Now, they can be too low, but honestly, that's not something that most people have to worry about. Okay, so what is the pathway of blood throughout the heart? And then we'll talk later in a different lecture about the pathway flow of blood through the body. So here we're just focusing on the heart itself. So when we think of the heart, we want to think of it sort of like a house. And this house has 4 rooms, but in heart talk, we call them chambers. This house has 4 doors, but again, in heart talk, we call them valves. And then this house has 4 sidewalks, but in heart talk, we call them vessels, right? Or you can call them hallways maybe if you want. Okay, let's go ahead and look at this. Again, if we're looking just at our little analogy here, right, we would say that we have 4 rooms, right? What are those rooms? Well, here's 1, the right atrium, right? 2, the right ventricle. 3, the left atrium. And 4, the left ventricle. Those are our 4 rooms. If we want to say, okay, how is blood going here? Well, it has to go through doors, right, to get from one room to the other room. So again, we have our tricuspid valve. And then we have our pulmonary semilunar valve. We have our bicuspid, or our mitral valve, it's called. And then we have our aortic semilunar valve. Those there are the 4 doors. And then you can see the 4 hallways, or the 4 sidewalks as well. The vena cava, the pulmonary trunk, the pulmonary vein, and then the aorta. If we look at flow of blood, this is sort of how it goes, right? And I'm going to show you a real picture on the next slide, but just give you a little cartoon. I think it really helps. And so really what's happening here, and I'm not going to color code it here because you'll see it on the next slide, but I do want to take red off because if we have red and blue, that stands for oxygenated or deoxygenated. We don't really want that at this stage, right? So let's just use good old black here. Okay, so this is how it works. So blood is coming back from your body after the oxygen's been sucked out of it, right? And it's coming back to your heart to get more oxygen. So we start up here, sort of one would be up here. Blood's coming through the vena cava, right? into the right atrium. It's going through a door called the tricuspid valve. Then what's happening is it's going into the right ventricle. Then it's going through the pulmonary semilunar valve, and then it's going through the pulmonary trunk. Then what's happening, and I would sort of help, ask that you sort of imagine this with me. Behind this picture, imagine the lungs are directly behind this picture. So when the blood's leaving the heart through this pulmonary trunk, where is it going? It's going to the lungs that's directly behind this picture. If we want to use an anatomical word here to make sure we're talking about the same thing, we would say it's deep to this picture. So this arrow at the bottom here is now going, and I'm not the best artist, but going straight into the screen, right, behind the screen, and there's lungs back there. It's getting oxygen, right? So you're breathing in, you're getting oxygen into the blood. Then what's happening is now, let's look at the top here, blood's coming from the lungs, so again, coming from behind the screen, and it's entering into these pulmonary veins. Okay, now we have oxygen. So now what happens? We enter in through these pulmonary veins, then we come through to this next room, the left atrium. We enter through this bicuspid or this mitral valve, then we're going into the left ventricle, and then what happens is we enter through the aortic semilunar valve and out the aorta, and now the blood is going to the rest of the body. Right, so the blood's going to the rest of the body. So let's put some labels on this here just so we could see this. Okay, so going to the body there, here the blood's going to the lungs, but remember the lungs are directly behind the screen. And again, if we want to color code what's going on, why don't we know? So I didn't color code a second ago, right? But let's go ahead and do it now. So if we say, where is there no oxygen, right? Here's blue. Okay, so there's no oxygen. But after it went behind the screen, the blood went behind the screen, we got oxygen from the lungs. Now, this whole path here, now we have oxygen. Okay, so that's how it sort of works there. So it's a nice little visual diagram. I realize it's just a cartoon picture, it's not real, but when we look at the next picture, I think this will help if you keep coming back to this. Okay, so that's the pathway of flow throughout the heart. Let's look at it in reality now. Okay, so what is the pathway of blood flow? Well, here we go. Here's a real picture. We're going to start at the exact same location that I had before, right? So where are we starting? We're starting right, and let me get off the red and blue so we don't get confused, right? So we're starting right in here. Blood is coming in. It has no oxygen. It's coming into the body through the vena cava, right? Superior just means from the top. Inferior means from the bottom. I think you guys got that now. So it has no oxygen. Then what happens is we're going to go the exact same path we did in the last slide, but I don't have to worry about color coding, right? Because it's already color coded for us. But let's look through it here. So what are we doing? We're coming into the heart. What's the first room we enter? The right atrium. And you can see it color coded below that. Then we go through the tricuspid valve, right, into the next room. And that's the right ventricle. Then we're going through our hallway or our sidewalk, and we have our pulmonary semilunar valve right there. I'm sorry, that was our door, right? Our pulmonary semilunar valve is our door. Okay. Now we're going to go through our sidewalk or our hallway, our pulmonary trunk. We're going to the lungs. So you sort of see that there. Now we're coming back to the lungs. We're going back to the heart, and you can see that we're entering back in here, right? We're going in through these pulmonary veins. We're coming into our left atrium. Okay, left atrium right there. We're going through our mitral or our bicuspid valve. You see it right there. Going into the next room, right? So this is our fourth room, the left ventricle. And you can see that that left ventricle is very thick if you look at that wall. Why is it so thick? It's sort of a nice context clue. It's going to pump the blood through the aortic semilunar valve, which you see here, through the aorta, and then straight out into the body, and then you're nourishing all your cells and all your organs. So that's the complete path of blood flow throughout the body. Now, it might seem a bit daunting. You might look at the last slide and this slide and say, oh my gosh, how am I ever possibly going to memorize all this? As you go through it more and more, actually it's something that students really latch onto and do a great job with. So we'll sort of make a game out of it in class, but I think this is something that eventually it'll be second nature to you as you go through it. Okay, so that's the blood flow through the heart. Okay, so in today's lecture, again, we focused on the heart. We had 3 different learning objectives. Before you proceed to the next lecture, please make sure that you can describe, explain all these different objectives, and then you have a good handle on it, and then you can go on to the next lecture of the heart. And the next lecture, we're going to start talking about after the blood leaves the heart, what happens to it then, and we're also going to talk about the electrical impulses that I mentioned earlier in this lecture.